Assalamualaikum warahmatullahi wabarakatuh. Good morning or good afternoon, ladies and gentlemen. Thank you for the opportunity given to me. Let me introduce myself first. My name is Friska Ayu. I come from Occupational Safety and Health Department on Faculty of Health, Universitas Nahdlatul Ulama, Surabaya. I will presentation my research result with a title, a review of Fit to Work assessment program on work performance of EV equipment operator during pandemic COVID-19 at Indonesia. With my team, Musliha Normal, Muhammad Syahri, Octavianus Sutapea, and practitioner from PT Pelindo Terminal Peti Kemas, Mr. Bondan Winarno. The reason why I choose this topic because all we know, this pandemic made several companies continue to make efforts to adapt with government policies to prevent the spread of COVID-19 virus in the workplace. One of them through is effort, namely fit to work assessment. A study of fit to work is a risk-based approach for the oil and gas industry show that it's important to implementation of fit to work because with fit to work can assure that individuals are able to complete the task safely without an acceptable risk to themselves and their employing company. The proposed risk-based fit-to-work design process includes five key steps. The first step is health risk assessment, and then control option, legal assessment, implementation, and review. Fit to work is usually assessed through several means, such as a physical examination, including a functional capacity test that is specific to the task, and then these checks are designed to apply equally to everyone performing to the work and should produce consistent result under testing. During the pandemic, various efforts were made by company management to prevent the spread of the virus without compromising the obligation of the reduce the number of work accidents that occur in the workplace, one of which was in a port service company in Indonesia. All we know that port service company in Indonesia that focus on cargo and container handling services are required to continue operating during the pandemic so that transportation needs and community mobilization are still made. Therefore, special strategies and programs are needed to ensure that safety and health of workers through the Fit to Work assessment program. The purpose of this research is to analyze Fit to Work assessment program on work performance of heavy equipment operators during pandemic COVID-19 at Indonesia. The methodology of this result design we using observational analytic with cross-sectional study design, and the population in the study are heavy equipment operator who are one of the subholding of PT Pelindo Terminal Peti Kemas Surabaya with 54 operator as participant. To collect information on this research, every or each participant was given a questionnaire containing two sections to fill as flows and fit to work assessment. The first one is sociodemography. The second one is perception work performance questionnaire. And then fit to work assessment, we can get the data from the clinic of the company. From table 4 about statistical test using multiple linear regression show that fit to work assessment influence 74.2% to work performance on heavy equipment operators during pandemic at a port service terminal Indonesia. This results show that there are influence between the fit to work examination and the perception of the performance of heavy equipment to work show if fit to work is not carried out on all workers, only given workers who voluntarily feel unfit, this can lead to workers who continue to work even in unfit condition, which is trigger unsafe action and reduce worker performance. Another study about the influence of health training and using personal protective equipment against work accident at construction workers show that the higher of the health factors, the lower the work accident factor in workers. In this research, showed that there is an influence between the fit to work examination and the perception of the performance of EV equipment operators. Fit to work assessment is carried out before work to find out whether the worker is fit or unfit to work in accordance with the level of health required. The weakness of from this program is fit to work assessment takes a very long time, need around 5 minutes each person, and health workers on duty only consist of one doctor and one paramedic. So the company must add health workers to expedite and speed up the fit to work assessment process. That's it. I can tell about my result. Thank you for the attention. Wassalamualaikum warahmatullahi wabarakatuh.